And there's two limits to this. One, you can't see what's happening. And number two, you don't know how to fix it. Hi, everyone. Welcome back to the podcast. Welcome all new listeners. For those who've listened to me in the past, welcome back. This is a phenomenal podcast. Don't you go anywhere. This is, if you enjoy treating active people or CrossFitters or anybody in that domain, functional fitness, F45, Orange Theory, if you enjoy working with them or you don't, I think you need to listen to this podcast because it's going to be key to being able to understand who they are and how you can deliver the best service. So, why do CrossFitters hate physical therapists? Before we go into that, let's go with some updates. Personally, there's so much going on behind the scenes. If you don't follow me on Instagram, Chris Garcia DPT, do it. If you don't follow Sports Performance, my company, you need to at Sports Performance PT. And there's a lot going on. There's a lot of moving parts at the moment. It's one of the busier times that we've had in a very long time. October has been a big month for me, and over the last probably 10, 11 years now. And I shared this with the team, and I'll share some exciting news with you guys. So in October of 2014, we launched the company Sports Performance, October 14th of 2014. Ironically, I started my weight loss journey last year, October 14th, 2020. So in the last year, I've lost 50 pounds, 50. I lost the first 40 in the first 4 months of the journey. So I lost 40 pounds in 4 months, and then over the last 8 months, I've just kind of been chipping away. So it's been a great year, and I'm excited about that. But why is this relevant? So I also got married to the woman of my dreams, my wife, in October of 2012. 10, 11, 12 was a year of our marriage. And so October has been big. So officially, I'm announcing it, and it's going to come out on social media. So by the time this podcast comes out, it should be live. If not, I just messed up. But we are officially launching our second location of Sports Performance in the city of San Diego. And that has been years and years in the works. And we officially have an amazing team to help launch this new opportunity. So there you have it. There's some good updates. That's what's happening behind the scenes. I have been on interviews. I have been talking to several people about what needs to happen in order for us to launch this. So if you guys are curious about that, follow us on media. Just learn about like the journey onto starting something new and fresh and doing something bigger and seeing what a mission actually comes out to be when you have an amazing team to help support that journey. All right, here we are. On to the podcast. Why do CrossFitters hate physical therapists? All right, not all physical therapists and not all CrossFitters, but there are some. Like if you were to ask a CrossFitter who, like, hey, have you ever been a physical therapist or physical therapy? They're like, that doesn't work. I've heard it myself. I'm a member of CrossFit gyms, and I like to go to them, and I like the community. I like the community aspect to it and the group setting. And I've heard it before, and that's why I'm bringing this up, because when I hear people say that, I'm like, oh, it hurts. Like it's right to the heart. Why? Why do you hate us? Like we love you. And I think that physical therapy, I was on an interview today with a physical therapist for a new role that we're looking for. And one of the things they said was, I asked, would you be concerned about somebody who said, I've tried physical therapy in the past. I've worked with two physical therapists, and they had a really good response. They're like, well, it just depends on what type of setting they were in and who it was. I completely agree with that. And so I think physical therapy as a whole, I don't like the term. I don't enjoy it, only because people have been tainted positively and negatively. But I think negatively is what really hurts us as a profession, where people have gone to places that may not be within like the wheelhouse of what you think of as like really good physical therapy. And I don't want to like talk about negative things. What I want to do is talk about that there's going to be different standards for physical therapy and different types of physical therapy. So as a whole, I think when people think of the words physical therapy, they already have a picture in their head, and they might have had a negative experience, and that's what hurts us as a community. And so CrossFitters in general I've heard this from them. They're like, why can't they just do it like you guys or other places that I've been to? And I'm like, that's really hard. And it's not always the clinician's fault that they had. It might have been the setting. They don't have enough time. They don't have, like, maybe they've been to a mill where they're just like racking and cracking. They're just like moving them through. And so that's really hard. A CrossFitter is a unique breed of people. And I don't know what your flavor is, whether you agree on CrossFit or not. I'm just saying in general, CrossFitters have they're a different breed. Their mindset is like, let's just do it. And on the interview today, I mentioned, I asked this person, how often do you work out? And I think they said like 3 or 4 times a week. And I was like, I train 6 days a week, and I am like near death every single one. And I'm like, let's do it again. But that's just me. I love pushing myself, like personally, financially, emotionally, my marriage, the job, like everything about it. I just want to keep going. And so for me, that fits my mindset. So for CrossFitters, you might have some of these people who are like all in it, and some who are just starting. And nonetheless, once they get into this fitness style, they want to like not stop. They just want to like go. And when you hear CrossFitters who have injuries, like they're beat, they're not happy at all. And that's the specific mindset that they have. Like, I just want to keep going. And when you impact that, that determines whether they're going to be a customer or client or a patient for life. And the hard part is that we as humans don't see that side. If you're not into that community, you're into something. I don't care what you do. Like, if you're into books, if you're into CrossFit, if you're into F45, if you're into bodybuilding, if you're into running or mountain biking, I don't care. Insert your passion into this podcast topic, and actually would work the same. All right, so let's take a mountain biker, because I know there's some mountain bikers out there. If you were mountain biking 3 to 5 days a week, and you just invested, I had a client the other day who invested $6,000 on a double suspension, like a rear and front suspension, and that was a big purchase for them. And now their knees started to bug them, and I overheard the conversation. They're like, I'm not going to stop. And I could totally get that. I empathize. Like, you just invested all this money in yourself. You're probably losing weight. Your trail is your suspension and your riding is so much better. You don't want to stop. So for that reason, I get that mindset. And so I'm talking about CrossFitters, just as relevant with what we've been doing around the clinic, and we've been seeing a lot of CrossFitters recently, and they don't like, there's a population that may not like physical therapists. And you have to ask why. Why would you hate us? We just love people. We just love you guys. We just want to fix everything. We're like the mechanics for the body. Like, we just want to fix it all. The problem is that we get so like narrow focused at fixing something, we forget that like they're humans and they never want to stop doing the thing that they want to do. And there's 2 limits to this. One, you can't see what's happening, and number 2, you don't know how to fix it. So let's talk about that. What do CrossFitters want? They want to just keep going. They don't want to stop. Yes, you can clean up their form. Yes, you can tell them to stop doing certain movements, whatever it is, but they still want to go 5 or 6 days a week. That is who they are. These human beings literally are addicted to exercise and intensity, and may or may not know how to do it with the right form. Okay, so now you as a clinician have to take all that in and say, well, you know why your back is hurting? It's because of your form, because you're doing 300 deadlifts a week, and you're doing box jumps, and you're doing back squats, and you're doing front squats all in the same day, and you're doing way too much. Your natural instinct says, you're crazy. Why are you doing this? Stop doing it, right? I think that's like most medical providers are like, why are you doing this? Drop the intensity, drop the frequency. And change up the type of exercise you're doing. Maybe decrease the load, blah, blah, blah. I think what needs to happen is that you need to see it from their side and be like, the mountain biker in you is saying, hold up, wait a minute. Like, how about we allow them to do a little bit and maybe provide some modifications, throw in a rest day, not back squat, maybe front squat, maybe add kettlebells instead of a bar. I'm like, there's so many versions. And that's what I'm saying. Sometimes physical therapists might not know modifications because they don't do the sport. And number 2, they don't know what to do with them in the event that they say stop. So this is why they don't enjoy working with physical therapists, because the physical therapist they may be encountering is saying, they might not outright say this, they might be saying, I don't know how to modify your sport, I don't know anything about it, and I don't know how to modify training, and for that reason I'm just going to tell you to stop. That's the only reason you would tell somebody to stop, unless there's like a fracture or something that's going to harm them. You can honestly say, okay, well, what if they have a herniated disc? Would you allow them to back squat and deadlift? No, but why can't they do other movements? Like, why can't they do any dumbbell movements or kettlebell movements? It's because of your lack of knowledge. There's two things, capability and capacity. So do you have the capacity to help support these people? Do you have the time? Maybe it's like you're doing 15, 30 minutes or an hour, and do you have the time to available to do it? Yes. Okay, I have an hour or a half hour, I can totally do it. Or I don't. Are you willing to do it on the back end, after hours or before hours or on your lunch break? Then if you're not, that's a personal challenge to you. Then your patients are going to suffer, and that's up to you from an ethical standpoint, what you want to do. Then there's a capability, like I just don't have the knowledge on how to do it. Oh, now we're talking. Now that just means that you need to be able to like learn some basics and fundamentals. But you have to understand that when these people walk into your world, they're not looking for you to say stop. And actually, like I said, you can insert runner instead of CrossFitter, and they're going to be the same. The minute you tell somebody who's like active on a kick, they're making improvements from their like physical standpoint, their mental standpoint, they're on a groove. Why would you stop that? Like, they love what they do. So then you got to figure it out. I don't care if it's pickleball. Pickleball is actually pretty popular here in San Diego. So pickleball is the same thing. Like, if you just have to see it from their side. If you're a runner and you don't understand CrossFit, think of them as a runner. Figure it out. Tell them what not to do. Tell them what to do. I call them bumpers. Give them green lights, red lights, and yellow lights. And then here's their bumpers. Here's where you can go, here's where you can't go, and everything in between is safe to do. So if they have back pain and they have problems picking up things from the ground, don't let them do that. They can go from the hip, or they can go from the knee. They can do seated exercises. They can do all upper body. They can't do lower body pressing. They can't run. They can't do box jumps. They can still do gymnastics. They can still do pull-ups. There's so many versions. And what happens is, if it's a capability thing, like you don't have the knowledge, that's why they don't enjoy working with physical therapists. Because I don't have the knowledge on how to work with somebody who does field hockey or ice skating. I don't work with those people all that much. However, just because I don't know, I'm not going to provide bad service. What I'm going to do is figure that out. So what happens is, these people get a bad rap with physical therapists because the people they may have seen didn't want to put the time and effort into modifying their workouts. So the easier thing, just don't do it. That's why a lot of physicians and orthos they just think CrossFitters are crazy. Maybe they've done it, maybe they haven't, but nonetheless, it's a passion of theirs. Now you can, like I said, you can change it out for a runner or triathlete or whatever it is. All of us are addicted to exercise in some form or fashion, whether that's mountain biking or rock climbing or being a triathlete. And the minute you tell an athlete to stop, you've lost all their trust. Absolutely lost all of their trust. Don't ever do it. Like, you're setting yourself up for failure. You're just another physical therapist in their eyes. That's true. And the reason I see it is because I hear it. We have a lot of clients who come in who have seen 3 to 5 physical therapists, 2 to 5 chiropractors, massage therapists, acupuncturists, and orthos, neuros, CT scans, MRIs, X-rays, you name it. And the difference is, we'll ask them, what's your training regimen? What do you do? How often? What does that look like? What's the movement? How can we move it around? How can we substitute it? What do you want to be able to do? And I think when you ask people that, those are better questions than like, why don't you just stop? Or like, what can we, like, why do you work out 6 days a week? I think more than anything else, I think you need to understand. If it's a soccer player, I think most people have played that, and I think because that sport is more familiar, they're more familiar with those movements, and they can provide modifications. So like the big ones, football, baseball, soccer, whatever's popular in your area, field hockey or lacrosse is, you're going to know those. But I think as CrossFit as a fitness is becoming more and more popular, I think people are becoming more aware of the general movements. Maybe you've done bodybuilding but never Olympic lifting, or you've never done variations of interval-based exercise. And so, regardless of the fact of whatever gym they're going to or their programming, I think what you need to understand is they are coming in with a preconceived notion. They may or may not. And I think you got to beat them to the punch. I think, have you had it before? Okay, you have, and you didn't like it. Why not? What didn't you like about it? Well, they told me to stop. Okay, great. That's what we're not going to do today. So what are you looking for? Well, I want to be able to continue exercising. My shoulder still bugs me. Well, what does it hurt with? Uh, Let me see. Handstand push-ups and shoulder press and push-ups and ring dips. Okay, so we have inferior, horizontal, and vertical pressing. I see. All right. When doesn't it hurt you? Pull-ups. It doesn't hurt when I row. It doesn't hurt when I am doing burpees. And so I think what you have to do is, okay, well, where's the bumper? Well, let's not vertical press for the time being. You can do all leg-based movements. You can still stick to whatever is painful. Work with their coach. Try and figure it out. Ask the local gym, hey, is there any way you can do modifications? I have a person with shoulder pain. And I think what happens is you got to be able to see what your weaknesses are. And I think we as a medical profession, we don't have to have all the answers. Like, stop thinking that because you went to school, you now, for like this specific degree, that you have to have all the answers. I don't think that's true whatsoever. I think that it puts you in the best position to be a coach or a captain to like say, I don't have the answer to this, but maybe somebody else does. I'm going to work with, can I call your gym, your coach, and ask them like, hey, what modifications? My name is so and so. I'm a physical therapist. I'm trying to find an answer for my PTs. You know what that gym's going to do? Man, that's a passionate physical therapist. I have a lot of injured people I can send their way, and they're literally genuine. The first person to call me and ask me for my help. I think that medical providers need to understand the athlete, and if they were a runner and a cross country athlete, you would call the coach and ask like, hey, what do we do with this cross country athletes? What are you doing? Are you doing mile runs? What are their splits? How often are they doing them? Are you doing all interval based stuff? Can we hold off on the mid distance, only go long, increase their cadence, whatever that is? I think that's more familiar because that's what you do. But you would be more than likely to do it with like a high school coach or college coach. And I think that these CrossFitters, they want that same experience. I promise you. Only reason is because I hear it literally every day. I'm going to the gym in a little bit, and I'm going to hear that same response. And I probably get somebody every day showing me a radiograph, an injury, and telling me that they have had varying experiences with their chiropractor, their massage therapist, their physical therapist, their doctor, and they're always trying to see like why can't they understand who I am? That's what they're really saying. Why can't they understand what I want to do? And I think that there's two components. One, they don't have the time, the capacity, or two, they don't have the capability. They just don't want to they don't want to learn. They don't want to be part of that. It's not enough in their wheelhouse of an investment to learn more about that. And I think that you got to find out where that is for you. If it's a time thing, that's challenging. You got to put time on the back end to make it worth your while. But if it's a capability thing, it's your decision to put time and effort into the people you serve. And I think they deserve that. If you're not treating somebody appropriately because you are lazy to figure out what they need in the background, that's really tough. That's selfish, is what I would say. And to be selfless, like that's why we got in this profession, because you wanted to help people. And just because you can't help them in the time that you're being paid or scheduled, I think that's very, very tough. I think some part of us has to go beyond that and ultimately do research, find out what it is. And the people listening to this podcast, you're in that world. You're willing to put in time. You love the hustle. You love you love to go above and beyond. That's just who you are. And I'm giving you this guidance because I see it, I hear it, and I want you to be the best professional you can be. And if that means that you're going to have to do extra hours or on a Saturday morning, go to a coffee shop, figure out a little bit more, find some research articles, I love that because that's what's going to need to happen. But ultimately knowing why you're doing this is some people, when you're dealing with CrossFitters, sometimes has nothing to do with research. It's just hearing them out and asking them, what is it that bothers you? How have you tried modifying before? I've never and be honest with them. I've never done this, but I'm willing to learn. Show me. What is a handstand push-up? Show me. What is a front squat? Who cares? Don't be embarrassed. Ask them. And that's what they're looking for. And the minute that they say, wow, that physical therapist cared, like they asked for my input. And I think that's a big difference. And that's why CrossFitters hate physical therapists, because of their previous history. Now, if they've never had a previous history, cool. They have no reason to hate physical therapists. But hate is a big word. Why they're reserved about physical therapists or physical therapy is because of their past. And I think there's a lot of main reasons why it's changing now. Instagram, social media, YouTube. I think a lot of physical therapists are now understanding that. But if you're listening to this and you're still having a challenge with CrossFitters, the one piece of advice I can give you is that you need to be a human with them and say, like, be honest with them. I've never tried this. I've never done it, but I'd like to learn. And what that does is they're like, that doesn't give them mistrust in what you're doing. It doesn't make them skeptical. Now they're like, all right, they're bought in. Like, all right, let me show you. And they do it, and they're like, oh, you know what? I know mechanics, and I don't know what that movement entails, but I know mechanics. What I would do is I would use more your legs here, churn your arm out. You're impinging yourself here. Maybe instead of a barbell, use dumbbells. And they're like, I've never thought about that. And now you're actually collaborating with somebody who you don't know anything about their sport with. And that's what CrossFitters love. I've been treating them for many, many years, and I do it myself. And what they do love is somebody who is willing to grow and learn with them. Like that's the art of it. These people love getting help. You know what they want? They want somebody, and I get this here, I get this a lot. They will say, hey, Chris, I'm not going to foam roll. I don't want to do lacrosse ball. I don't want to do yoga. I don't want to stretch. Can you work on me? And as a clinician, you're like, man, I want you to be independent. I want you to do it. I want you to do it. And sometimes they just need a little bit of, like, what we call tune-ups, like, or just wellness care, right? They just need a stretch session, a little mobility work, give them a couple of new corrective exercises, and they love that. Like, CrossFitters love that piece. And I think as a profession, we call that an enablement model. Like, they're enabled by it. No, they want it. They're literally asking. And, I find that's ironic, because you have somebody who wants something, a consumer, and the healthcare provider doesn't want to do it because it provides something that they're morally against, which is enablement. But if you don't see it as enablement, these people really need the help. And they're willing to do it on their own, but they just need a little, like, kick in the pants every once in a while. Hey, are you doing your stretches? No, come see me, update these things, and then you're back on your way. And CrossFitters are a unique breed. They will be very honest with you. They really will, because they typically won't stop, and they need the help and support along the way. And because their intensities and their volume, their frequency always changes, they're always beat up somewhere. This week it's the shoulder, next week it's the knee, the following week it's the heel or the foot or the big toe or whatever it is. And so because of that, they always need that support. And so why do CrossFitters hate physical therapists? For all the things I said. So if you can fix those things and you can really help guide them and understand, like, what they do at the times that they do it and that they're going to continue to do it, your job there is to give them support and accountability along that way. Be honest with them. Tell them how much you know or don't know and how much you're willing to learn. And those people will be your patients and customers and just ambassadors of you as a person, and so they will love you. I promise you. This is an approach I take with all of my athletes, and it can be a pro football player. It doesn't matter. It's all the same. So this is just talking about CrossFitters because I'm in that world and I hear it, and I've been hearing it more in the clinic, and I had to share it with you guys. So that is why CrossFitters dislike physical therapists. Well, there you have it, guys. I hope you guys are doing great. I hope that fires you up. So that way you can treat your patients just a little differently, a little bit better on Monday, and just change the way that you view what you do for people. All right, guys, I hope that helps. I will see you guys on the next episode. Take care.